Welcome to Equine Guelph's Research Radio, a monthly look at the cutting-edge research being done at the University of Guelph, brought to you by SSG Gloves. SSG is on the cutting edge of premier gloves. The original SSG all-weather glove is our most popular. Quality, durability, fit, and comfort perfect for any equine discipline with its AquaSuede Plus Palm and elasticized back for cool, comfortable fit. All you have to do is throw it in the wash and let it air dry. The original, the SSG all-weather glove. See your SSG dealer for details. Our guest today is Dr. Keith Betteridge, who is conducting research into early pregnancy loss in mares. It's more than a fancy scientific name. It means the loss of a lot of money and time to the horse breeding industry. And Dr. Betteridge joins us. How significant is the problem of early pregnancy loss in mares?
To answer that question, you realize that people can now diagnose pregnancy as early as 10 to 12 days after breeding or after ovulation and successful breeding. If you have 100 pregnant mares, about 17 of those will not produce a foal. So there's a rate of loss of about 17%. And the interesting thing to us is that most of those losses, about 60% of those losses, occur in the first month of pregnancy.
What has your research revealed in that critical first month that might reveal some clues as to the causes?
Well, quite a lot, because we are able to study the way the embryo and the mare interact during early pregnancy. This is a phenomenon that's taken for granted now, but it used to be thought that the pregnancy was solely governed by the mare, but in fact the embryo itself plays a very active role in establishing and maintaining pregnancy. And there's an exchange of signals between the mare and the embryo and its membranes that are absolutely vital if pregnancy is to be maintained.
Tell me about prostaglandins. I hope I said that right.
Yes, and you touch on the system we're using to study embryonic loss, because if you think about it, to have 100 pregnancies and wait around until you've happened to fall on the 17 that are going to be lost is a very logistically a very difficult way to approach the problem. So we've been using a means of inducing embryonic loss, and the one we've chosen is to use prostaglandin. Now, you may be more familiar, and some of your listeners will be more familiar with the use of prostaglandin to so-called short cycle mares. What it does is that it causes the corpus luteum, that's the replacement of the follicle in the ovary, and it's the source of prostaglandin in pregnancy. The source of progesterone in pregnancy. Progesterone being the predominant hormone that is essential for the maintenance of pregnancy. And if you knock out the corpus luteum, sorry to use all these terms, but
that's okay.
That's part of the law. If you knock out the corpus luteum, you reduce progesterone levels in the mare, and the pregnancy will be lost. We have been using prostaglandin to treat half our early pregnancies and to then recover the embryos at various intervals after using the prostaglandin. And then we can compare those pregnancies, which we know are going to be lost, with other pregnancies which we give a control injection just of physiological saline. It's just a means of having a controlled experiment. So by comparing the normal pregnancies with those pregnancies that are going to be induced to be lost with the prostaglandin, we can start to see what the differences are between the signals being exchanged between the mare and her embryo, or her conceptus, as the term is.
correct me if I'm wrong, but during my reading leading up to our interview, I believe I saw a portion where prostaglandins can be found in any number of sources, including caterpillars.
No, not caterpillars. Actually, prostaglandins are a very interesting group of compounds, and the way that they entered into farm animal reproduction was through research on a sea whip. It's a marine organism, and it's a big source of prostaglandin. That's the source that the Upjohn Company first used to extract prostaglandins, which we now use routinely in clinical practice.
I see. So it's nothing that the mare might ingest during the course of her normal activities while in early pregnancy.
No, I think you're getting. I think you're thinking of the in caterpillars. You're talking about the outbreak of reproductive loss syndrome in Kentucky, which was so devastating in the early part, a decade ago, or more than that now. It was in 2001, 2003. There were massive losses in Kentucky from ingesting caterpillars, but that was not due to the prostaglandin.
I see. So what has your research revealed now? Where are we at now in terms of what the research is showing us?
Well, we're moving into the era that has been changed so extraordinarily much by molecular biology. And we're using molecular techniques to find out the nature of those signals that I mentioned, those signals that are exchanged between the mare and the embryo. And so by taking material from embryos that we know are being lost and those which we know are being normal, by comparing them with the techniques of molecular biology, we're building up a library of compounds which look like promising candidates for being things that go wrong when a pregnancy is to be lost.
Is this type of loss significant to the breeding industry right now?
Oh, yes, I think it is, because 17% is important, not just for that loss of that particular pregnancy, but also time, because as you know, most breeders are aiming for foaling at a particular time of year, which means getting their mares pregnant at a particular time of year. And once you go past that, if you start a pregnancy and then it's lost, you've lost that amount of time and you have to start all over again.
Fascinating stuff. Dr. Betteridge, thank you for your time.
It's a pleasure to talk to you, Norm.